from the NewsChannel 5 network. This is the Takacs McGinnis Elder Care Law Hour.
Welcome to Takacs McGinnis Elder Care Law Hour. I'm Tim Takacs, and in today's episode, as always, we're going to be talking about issues involving aging, chronic illness, and unexpected illness. As I said, I'm your co-host, Tim Takacs.
And I'm Barbara McGinnis. Specifically in today's episode, we're going to talk about the often confusing topics of Medicare and Medicaid. What's the difference, and what kind of information do you need to know to help your family make good decisions? In the course of this hour, we're going to have various experts that's going to talk about Medicaid, Medicare, Medicare Advantage plans, and we're going to start with the basics. We've got with us Joshua Bay and Berkley Crain, who are public benefit specialists that work at the Takacs McGinnis Elder Law Firm. Welcome, Berkley. Welcome, Josh. Good morning. Berkley, sometimes people do get confused. Just the whole naming, Medicare and Medicaid, they sound alike, they think they're the same, but they're not. Can you tell us what the basic differences are?
Sure. So Medicare is a federal health insurance program for people age 65 and older, and people under age 65 with disabilities, and that's regardless of income or resources. Medicaid, on the other hand, is a joint federal state program for people of all ages based on limited income and resources. Now, some people have Medicare and Medicaid, in which case they're referred to as dual eligibles. And in this case, Medicaid would actually pay secondary to Medicare as a supplemental insurance.
So Josh, there are a lot of urban legends, I guess we'll call them, about surrounding Medicaid. You know, people come into the office and they ask questions, can they give money to their kids, and all of those sorts of things. Will the nursing home take my house? Can I give kids an early inheritance and all that? So what are some of the tips that people need to know about Medicaid?
Well, nursing home will not take your home if you have a payer source, either private pay or Medicaid as a payer. Now, if you do not have a payer source, they can recover from the sale of your home if you build a big tab at the facility. So they'll put a lien on your home.
Right.
Just like any other creditor could,
Exactly.
right? Yeah.
Exactly. And with the early inheritance, that's a yes and a no answer.
Okay.
If you want to give an early inheritance, TennCare will establish what's called a penalty period because you're gifting. You can't gift anything for the purpose of applying
for Medicaid.
For Medicaid.
So
correct.
Medicaid has a lot of rules about how to gift and do
Correct.
all of that.
And you may want to talk with someone who specializes in Medicaid Choices program before you think about giving things away.
Because a lot of people give a lot of bad advice out there
advice,
too.
yeah.
And we have seen that come in where families have been told to go ahead and just put everything in another checking account, and you can't do that.
Exactly. And you may have a family member who giving their house away to their kids, and that's not the smartest thing to do, even if you want to protect it from the government, because that's not a protection
Yeah. Because one of the favorites, I know, having all of us having done this for a long time, it's real interesting to try to figure out what's the best ones that we've heard. I know one of them that's very common is well, I can give away $10,000, right? Because
Correct.
the government says I can do that.
Correct. And
so what's the reasoning about, or the bad reasoning about that?
Well, if you give away anything, again, it's considered a gift, and TennCare will establish a penalty period, and that's a certain amount of time that you will not be approved for Medicaid pay.
But the $10,000, people think about that as being like a rule of tax law. Right, and it's not the same.
Exactly.
Yeah. Well, Josh, what are some of the benefits of applying for Medicaid, even if you might have some funds in the bank,
Well, it's the unknown, I think. So if you spend naturally down to $2,000 or down to what TennCare tells you to spend down to, what if you do get better and you no longer medically qualify for choices? Now you're back out in the community and you spent down your funds. Now you may not be able to survive because you've spent down your funds to naturally qualify. And also, if you have a young community spouse that's living in the community that's retired but very young and still has a life to live, TennCare will allow them to have funds. So, some people, like to naturally qualify for choices, but there's ways to, stash money in Medicaid qualifying accounts that will, qualify you for choices.
Stash money.
So we're really talking about restructuring in a way that's compliant with the TennCare rules. And the other thing about TennCare applications are you always have to tell them everything you've done with your money,
Exactly.
right?
Exactly.
And they have the right to know everything you've done with your money for the last 5 years.
Exactly. Yes, ma'am.
So you have to tell them. And if you don't tell them, it's what?
It's fraud.
Absolutely.
Right,
Absolutely.
and fraud is an F, which means it's a felony. Yes. One thing that I think also that we know about, I know that I've learned a long time ago, having done this for a while, is that some people think that Medicaid is a program for poor people.
Poor people, exactly.
Right, and we like to think of it's not a program for poor people, it's for people who qualify for it.
And it's also not an entitlement program either, so you don't, automatically, you're not entitled to choices just because you're living in a nursing home.
Right. It's something that you have to meet financial and technical and medical eligibility requirements.
Correct.
Yeah.
Right.
So we started talking about Medicare and Medicaid, and then we switched to talking about TennCare and choices. But in Tennessee, that is what we call our Medicaid program. And choices is specific to what, Josh?
Nursing homes, you have choices 1 and choices 2. So choices 1 is nursing home, choices 2 is home and community-based services.
Okay, so you can get Medicaid at home?
Correct, you can, and they pretty much have the same financial guidelines and the same medical criteria.
Right. So how long does it take to qualify for Medicaid? Or let's say, okay, so TennCare and Medicaid and choices are basically the same thing.
Same thing.
TennCare is our overall Medicaid program in Tennessee.
Correct.
Medicaid is the state, like the federal program, I guess.
Correct.
And choices is the long-term care component, right?
Mm-hmm.
Of this program. So how long does it take to qualify?
Generally, 45 to 60 days. You may not hear anything for 45 days, and then you may get a phone call from a caseworker or a letter from a caseworker, asking for these verifications, and you have 20 days to get that to them. So initially it's slow, it's quiet, you don't hear anything, but then when you get a letter from Choices, it speeds up the process, and you have a certain time limit to get these things to TennCare.
Right. So it's a process, and if you meet the criteria, then
correct, you'd be approved.
You'd be approved.
Correct.
All right, Berkley.
You're up. Mm-hmm.
Tell us about the different parts of Medicare, because it's not just Medicare, right?
Exactly. So there's 4 parts to Medicare. That's Part A, B, C, and D. And I think it's helpful to think of these in terms of original Medicare versus Medicare Advantage. So original Medicare refers to Part A, which is hospital coverage, and Part B, which is medical coverage. And both of these are administered by the federal government. You also have the option of enrolling in a Part D or drug plan for your prescription drug coverage. And many people also purchase Medigap policies or supplemental insurance to pay for the deductibles and co-insurance that Parts A and B do not cover. Now, Medicare Advantage is also referred to as Part C, and that's the alternative to original Medicare. So these plans are managed care plans, frequently HMOs and PPOs that have particular network rules and restrictions. And they essentially wrap up all the same benefits that Parts A and B do, but under a different fee structure. And if you're enrolled in one of these plans, you cannot also enroll in a Part D plan. So drug coverage is often included, and you also cannot purchase a Medigap or supplemental policy.
So before we wrap up, we've just got a few seconds, with all these moving parts, how do people know what's the right plan for them?
So I think cost and convenience are 2 factors that really weigh in when people are deciding between the 2. Just briefly, original Medicare is typically known as being more costly up front as a result of the premium associated with Part D plans and Medigap policies. What original Medicare does allow, though, is provider freedom or more convenience in that sense. Medicare Advantage, by contrast, is maybe less costly, but does come with more rules and restrictions.
Right.
Oh, thank you, Berkley. Thank you, Josh, for giving us today the basic overview of these two very complicated programs that affect all of our seniors' lives. In our next segment, we are going to have a familiar face with us, and we're going to be talking more about the specifics of Medicare and your employment. See you after this break.